everyone in Ukraine. We'd be so happy to have you here in Thunder Bay, Ontario in the Recreation Therapy program at Confederation College, and we hope that you think about joining us here. My name is Stephen Holloway. I'm a professor and program coordinator with the Recreation Therapy Diploma program at Confederation College in Thunder Bay, Ontario. And here in Thunder Bay, we offer a 2-year diploma, and we also have a 1-year accelerated diploma for folks with qualifying degrees and diplomas from other universities or colleges.
Okay, can you name any of the universities a student can transfer from your program and get bachelor degree?
Yes, I can. Yeah, we have an articulation with Brock University, which is in Southern Ontario.
Mm-hmm.
We're also connected to the University of Lethbridge in Alberta, and so they offer a 2-year post degree, whereas Brock provides a 3.5-year degree. Our diploma is also eligible for Dalhousie University in Halifax, Nova Scotia.
Okay.
Those are some of the most significant universities in Canada for therapeutic recreation degrees.
That's really great. So you mean that a student can have 2-year diploma program in Confederation College and then transfer to university for another 2 years, more or less?
It varies. University of Lethbridge, it's 2 full-time years. Brock University, it's about 3.5, and Dalhousie is about 3.5, depending on how quickly you do it.
Perfect. This is a very great opportunity for a student and for a person to live in different places to start with, right? And also to combine college experience with university experience. That's really cool. Okay, so can you please explain what recreation therapy means? What exactly is this program about?
So recreation therapy is the use of leisure activities to attain therapeutic outcomes for clients living with some type of challenge. Historically, we used to talk about disability all of the time, but I think a global situation like COVID makes us aware that all of us live with challenges in our lives. If we look at stress and coping right now, for example, recreation therapists are very effective at teaching coping strategies. So for example, one of the things that our students are doing right now, because they're challenged to go out onto in-person placements because many of our organizations are closed right now, is that they've been working with a person in their life. And what the students have discovered is that although we'd learned a lot about disability, impairments, how to modify and adapt leisure activities to make them meaningful to all people, how to use activity to meet therapeutic outcomes, it's quite apparent that recreation therapy is something that all people can benefit from. And if we reflect on our own lives, let's say, for example, we enjoy exercise. Mm-hmm. We're aware that there are many positive hormones that are released in our bodies when we exercise that literally make us feel better. The hormone cortisol, for example, is a stress hormone that's broken down during exercise. So we tend to feel more relieved and more centered after exercise. So that's a really tangible example of what we try to organize for clients in a recreation therapy setting. Folks may also be familiar with music. So the use of music as a care intervention is becoming more and more prominent. And so again, we teach students, how might we use music as an intervention tool. Recreation therapy occurs in many different settings. It occurs in community-based settings. So we may have graduates working with folks living with developmental disability, people living with acquired brain injury who have left the hospital and are transitioning back into the community. Or we might have graduates working in clinical settings like long-term care facilities, working with older adults. Working in rehabilitation centers. So working with folks with mental health related disorders in hospital settings is also very common. So it's a very diverse diploma in that we learn a lot about the diversity of humans. We learn a lot about leisure activity. We learn a lot about how to make leisure activity attainable. And the foundation of all of this is our therapeutic recreation process, which you'll find in any human service. The process whereby we assess a client, we plan suitable interventions, we implement them, we evaluate their effectiveness, and we learn how to document the entire process professionally.
So what is the typical group size of the course?
You know what, our numbers during COVID have stayed pretty stable. We've been able to transfer to online. We've maintained a few in-person experiences, but very few. So our typical class size is 40 students. So in a 2-year program, we'll have 40 in the first year, 40 in the second year. And it's really an ideal size because students do gain that student-centered approach where they really get to know their teachers. They're able to access help from teachers at any time. And our class tends to form a very sort of family type unit. Even speaking with the second years who are about to graduate now, they really reflect on the strong connections with peers, the enjoyable experiences, the support that they get from each other, and really forming positive lifelong memories as a result. Historically, recreation therapy is a female-dominated profession. Now, I've been teaching in this at this college for 8 years, and then I worked in the field for 12 years prior to that. And so most of my work was with women. I would say 5 to 10% of the people who I worked with weren't women. But that's changing, and we're seeing that in all of our fields. So fields that were historically dominated by men or by women is changing significantly in Canada. So I would say at any given year now, we're about third male and 2/3 female in the class.
So I know that in the recreation therapy program, there is the scope or practical part. Can you please explain for how long it lasts and when it's on the first year or on the second year of the program? When do students have some practice?
There's sort of two parts to the question. The first part is that we try to include practical aspects in every single one of our credits. Colleges in Canada are historically hands-on. Hear about it, but then do it, practice it, know how to do it properly before you graduate. Which isn't to say that universities aren't, but certainly in my university experience, I've found that not to be the focus. So really the focus in our course is, the theory is important, but actually knowing what to do with it and what are you going to be able to apply when you're in the workplace. So because of that, every single credit includes practical aspects where you're practicing your skills either with your classmates or even with clients out in the community. So for example, in the second semester of the first year, students do a special project where they're connected with one of our employers and they do a special event for them. So they facilitate a recreation therapy event. So that's kind of the first real experience. And then for students in that 2-year program, when they get into third and fourth semester, they do 2 placements. So the first placement is 150 hours. The second placement is 300 hours. We may change this. But whatever the change lands up being, will still be 2 experiences with employers in Thunder Bay, learning about and practicing recreation therapy skills. Now, for students in the accelerated program, and so these are students that have a qualifying degree or diploma, and the common ones are things like social work, nursing, physiotherapy, outdoor parks, recreation, and tourism. They will do a 450-hour placement just in the second semester. So accelerateds get 1 placement, 2-year program folks get 2 placements. And it's quite common for students to be employed by their placement. And even if they aren't, when students leave our program, they have a wonderful resume where they not only have a diploma, but they have 2 practical experiences on their resume. So it does create a really great start for employment.
Since it's partially international, first part of the group is international. So do you have or do they face any troubles with language because of the language level, actually, not the requirement?
Some students do. Yeah, there is again, it's not my area of expertise. I don't handle this, but my understanding is that when students gain their student visa, they have to submit an English test.
Yeah.
And some of the students coming in, very functional in English writing and reading and speaking, and some are struggling. Some seem to not get all of what we're saying, and it is definitely a strength of a student is capable in English. Will make a significant difference. So the prerequisite for our program is really just high school completion. That is all. So as long as a student has completed high school, they can gain access to our course. Some students in Canada who did not complete high school, they have to complete an equivalency program. So really high school expectation is what we're looking for. One of the areas that I think some students are challenged in is really understanding that recreation therapy is about people. It is about clinical settings and community-based and all of this jargon that we teach, but it is about people. And so the student has to genuinely enjoy people. They need to genuinely enjoy spending time with people, talking to them, learning about them, really developing a deep memory and knowledge of all of their clients.
Any maybe interesting exercise or case you discuss with your students, something, interesting that you do with your students?
Yeah, something interesting that we did this past year that's relatively new in recreation therapy is the use of magic. So occupational therapists have been using magic tricks like a magician would do, as a therapeutic activity for years. And when we hear it, we're like, well, what does this have to do? And part of the trouble is that we usually think about magic as entertainment, and recreation therapy is not entertainment. That's some of the challenges people run into, where it's like, well, what's the intention? Are we trying to entertain, or are we actually trying to promote behavioral change? So we learn magic tricks, and we learn how to prepare a magic trick, how to present a magic trick. But more importantly, we learn about what can you accomplish for a client by using a magic trick. So for instance, if you're doing card tricks, you're working on fine motor skills, right? Because we're using our hands. And if you think about a person living with a stroke, usually a person with a stroke will have use of one half of their body and not the other. Well, card tricks, you have to use both hands. And when you watch clients living with stroke, they're strongly motivated to use their hands. And if you're doing it in a therapeutic group, everyone is struggling. So they don't become the focus anymore of someone who is sort of fumbling and struggling. They're with people who are living with the same situation, and the focus is the magic. It's less so about the stroke anymore. The other interesting thing about magic tricks are social skills. And so when we look at populations living with autism, there's great documentation of, more or less teaching folks with autism to be magicians. Reason why that's so important for autism is it helps a social deficit. There's a lot of social skill in being a magician, right? You have to be confident. You have to be able to introduce yourself, present yourself. Often you're facilitating a trick with somebody else, where you're asking them to participate with you. So that, I think, is sort of really interesting and unique intervention, and tends to get students to think quite differently about activities and the possibility of them.
Do you want to add something, maybe something particular about the program?
The employment opportunities are really great. One of the challenges we run into is that students will look up jobs and they'll say, well, therapeutic recreationist, recreation therapist, there are only a few jobs in Thunder Bay. Well, of course they are, because we're only a city of 100,000 people. But what this diploma gives us is a human service diploma. And what we notice is that virtually every organization working with disability in Canada is working in recreation and leisure. And so they all need professionals to work in those programs. For international students, what's really appealing about our diploma is that you can work anywhere across Canada. Some diplomas are specific to particular provinces. For instance, our paramedic program at our college is only specific to Ontario. Great program, but you got to stay in Ontario. Recreation therapy can go across Canada. So we have graduates working in pretty well every province in Canada. So it's a great opportunity to be able to start in Thunder Bay, but then to explore further.
So again, thank you so much. And I wish you a very easy